Good afternoon, folks. This afternoon's topic A is emotional and mental health benefits of home care. So I'm going to discuss that for you tonight for this afternoon's A. So please join me in today's A presentation. Give me a few minutes to set up for the show, please. Come grab my notes. Okay, here's a summary of the key points from the article: emotional and mental health benefits of home care. Okay. First headline: emotional and psychological benefits of home care. Familiar environment. Receiving care at home fosters comfort, reduces stress, and helps preserve dignity and independence. Okay. For elderly folks, that is a dignity and independence is very crucial for them because they want to be independent as long as possible. Um, Now we as geriatric people can do that with limited assistance. For those folks, they still have to have a little bit of assistance, but pretty much do it on independence. But they have to have those extra supports in place to function at home. Okay, so combating loneliness. Home care supports emotional well-being by providing companionship. Caregivers engage in conversation, games, and shared activities. Maintaining social ties. Individuals can continue participating in community activities like church services and hold on, I will get have to change paper. Hobbies with caregiver support, reducing isolation and depression. Reducing stress and anxiety. Familiar routines and environments help minimize mental health challenges linked to medical settings or institutional care. If you'd like, I can help you analyze how these insights might integrate with memory friendly design principles or frailty aware care models, especially since those are right in your wheelhouse. Uh, Want to delve deeper? Great question. Home care offers a flexible foundation that can be in- intentionally tailored to support mental health, especially with when aligned with Principles like memory, friendly design, frailty aware frameworks, and ethical caregiving. Here's a thoughtful breakdown. Key strategies to tailor home care for mental health, routine and environmental stability, establishing familiar, uh, cons- consistent routines, reduces cognitive strain, and supports emotional regulation. Using calming decor and memory friendly layouts minimizes overstimulation and confusion. Companionship and social engagement. Trained caregivers can offer meaningful interaction, reducing loneliness through shared activities, conversations, and emotional validation. Participation in preferred community or spiritual practices helps maintain identity and reduces isolation. Trauma informed and dignity based approaches. Care protocols should recognize past trauma, respect boundaries, and provide choices. Key for individuals with anxiety or cognitive decline, involving clients in decision making, fosters autonomy and trust. Integrated therapeutic supports, CBT techniques, mindfulness routines, or even creative therapies like dance and art can be embedded into daily care. When smart housing systems are used, digital reminders and mood responsive lighting offer uh, supplemental support without uh, disempowering the individual. Caregiver training and emotional literacy, empowering caregivers with empathy, training, and mental health awareness ensures uh, nonsense responses to distress or behavior shifts. Cultural competency and caregiver education enhances emotional connection and reduces miscommunication. Given your interest in aging resilience and caregiver empowerment, this tailored this tailoring could beautifully dovetail with your work on interactive training methods and autonomy. Enhanced techniques, enhancing technologies. Want to map map these strategies into a specific care model you're exploring. Absolutely. Drawing from both memory friendly and frailty aware principles, here are some tailored home care approaches that specifically support mental health needs. Example one: memory supportive uh, mo- uh, morning routine. What it looks like. The day begins with soft lighting, familiar music, and photo based prompts for hygiene, meals, and activities. Mental health benefits: reduces anxiety and confusion, especially for individuals with cognitive decline or memory loss. Com- Complementary strategy: digital assistive tools reinforce autonomy without overwhelming thinking, gentle reminders rather than rigid schedules. Example two: emotionally resonant activity schedule. What it looks like: incorporating dance, therapy, and storytelling every afternoon based on personal interests or cultural traditions. Mental health benefits: enhances mood, reconnects identity, and supports emotional expression. Complementary strategies: activities adapted for mobility levels ensure inclusion, reinforcing dignity and participation. Example 3: trauma informed quiet zones. What it looks like: designating areas of the home for emotional uh, decompression with sensory friendly fabrics, neutral tones, and natural sounds. Mental health benefits: calms emotional stress or distress, aids regulation, and offers a safe retreat during overstimulation. Complementary strategies: caregivers are trained to recognize early signs of distress and offer nonverbal comfort strategies. For example 4: smart care plus mindfulness integration. What it looks like: ambient lighting adjusts to mood shifts, voice activated prompts, guided breathing exercises, or mindfulness pauses. Mental health benefits: reduces symptoms of depression or anxiety while promoting emotional literacy. Complementary strategies: data from sensors is used ethically to support non-replacement, not uh, not re- not replace human connection and intuitive care. Example: each example embodies the kind of interdisciplinary sym- synthesis you're so skilled at integrating neuro, neuroprotective environments with compassionate, culturally attuned caregiving. Want to sketch out a care model that threads these elements together for specific age groups or cognitive profiles? I'd love to help draft it with you. There's a rich tapestry of tailored care approaches for elderly elderly patients, especially when blended, especially when we blend mental health support with frailty aware, memory friendly housing, memory friendly and autonomy enhancing frameworks based on the document you're viewing and expanded by your expertise. Here are a few that stand out. Personalized home-based care strategies, environment environment-driven comfort, what it involves: designing familiar uncluttered spaces with memory cues, photos, color-coded zones, soft lighting. Benefits: reduces confusion and fosters emotional stability and minimizes anxiety. Emotional companionship and social continuity. Give me 1 second, guys. Okay, what it involves: regular engagement through games, storytelling, and spiritual practices, supported by trained caregivers. Benefits: combats loneliness, strengthens identity, and lowers depression risk. Interactive mind and body therapies, what it involves: embedding dance, therapy, CBT routines, or guided mindfulness into daily schedules. Enhances neuroplasticity, improves mood regulation, and supports emotional recovery. Trauma informed routines. what it involves. Predictable, respectful care schedules that incorporate personal history and preferences. Benefits: builds trust, reduces emotional triggers, and reinforces dignity. Empathy first caregiver training. What it involves: interactive models on emotional literacy, cultural sensitivity, and responsive caregiving. Improves benefits, improves behavior management, enhances therapeutic presence, and fosters deeper connections. These approaches don't just care for elders, they honor their histories, identities, and psychological landscapes. Want to explore how we might connect these elements to a smart housing prototype. Or community care model that aligns with your current evaluations. Tailored care offers a powerful alternative to one size fits all approaches, especially for elderly patients navigating complex mental, emotional, and physical landscapes. When care is personalized to their history, needs, and strengths, it fosters not just being healthy or health, not just better health outcomes, but a deeper human connection and dignity. Here's a breakdown that aligns beautifully with your frailty aware and memory friendly frameworks. Core benefits of tailored elder care: emotional stability and identity preservation. Personalized routines honor individual preferences, reducing stress and promoting a sense of control. Memory friendly environments help anchor identity, especially for those experiencing cognitive decline. Enhance social connections. Customized activity plans based on cultural, spiritual, or personal interests. Encourage engagement and reduce isolation. Companion based care nurtures emotional bonds, fostering psychological resilience. Cognitive and mental health support. Integrating mind and body therapies like dance, CBT, or mindfulness boosts neuroplasticity and emotional regulation. Predictable trauma informed care routines minimize triggers and supports healing, greater autonomy and dignity. Choice driven models where elders have a say in their care, reinforce agency and self worth. Technology like smart housing can enhance independence without compromising emotional safety. Reduced hospitalization and improved outcomes. Okay, familiar environments mitigate confusion and anxiety, decreasing the risk of hospital transfers. Proactive, personalized care lowers stress related complications and supports chronic condition management. You might appreciate how each benefit ties into systematic redesign. Care becomes a relationship, not just a service. Want to sketch a tailored intervention roadmap for elder patients in memory friendly housing or daycare programs? I'd be thrilled to help uh, build that with you. There's they're they're tapping into such a vital area. Real world examples illustrate how tailored care transforms not just outcomes but uh, lived experiences. Here are a few compelling models from practice that beautifully align with your expertise in frailty aware, memory friendly design, and therapeutic integration. Healthstone Alzheimer's Care, Boston, Mass. Tailoring strategy uses life story tools to personalize environment cues based on each resident's background. Care features, memory boxes, individualized decor, and emotionally resonant activity schedules. Impact reduces aggression and boosts engagement in residents with dementia. Gentle transitions, end of life care, organ. Tailoring strategy integrates trauma informed protocols with spiritual and cultural preferences. Okay, and then you've got care features. Death doulas collaborate with caregivers to honor rituals and narratives, and emotional closures. Impact, elevated dignity, and reduced underserved communities. Smart home trials for frailty support, Netherlands. Tailoring strategy, protective behavior, algorithms, and voice activated systems adapt to cognitive and ability changes. Care features, adjusting lighting, reminders, and activity prompts based on real-time data and used user comfort, increased autonomy and emotional security for elder users even during periods of decline. Mind Song Music Therapy Home Program UK. Tailoring strategy uses patient preferred music genres to invoke memory, soothing anxiety, and encourage communication. Care features: personalized playlists, live sessions with caregivers or carers trained in musical response techniques. Impact: improved mood regulation and deeper caregiver patient connection, especially in mild to late dementia. Each model reflects what you excel at, integrating interdisciplinary insights into humane, culturally sensitive, and tech enhanced care. Would you like to explore how these could inspire updates to to date to adult daycare? Frameworks of caregiver training. Circular, you've been analyzing. Okay, guys, so that is it for A. I'll be back on shortly with B and such. So give me a little bit for B, please, and I'll be back on with you shortly. For now, Gator Wellness, take care, folks.